If you've ever had a serious surgery or dealt with severe pain, you may have been prescribed a type of opioid. Opioids are still some of the best medications for treating severe pain, but they are meant to be a short-term solution. When opioids are used for long periods of time, you might develop a tolerance, a dependency, and eventually an addiction.
Once you start using, you get this incredible dopamine spike that you want to replicate. And then what happens as you use over time is that you get the dopamine spike in your brain about acquiring the substance. And so basically your neurocircuitry gets rewired and so that your brain is just motivated to use.
What may happen is that you may develop a tolerance for opioids. This means you need larger and larger doses to get the same dopamine spike and pain relief. This can lead to a dependence, which is when the body and brain have adapted to expect opioids in your system, similar to how coffee drinkers have headaches if they skip their morning cup. People with opioid dependence will have unpleasant withdrawal symptoms if they stop using opioids.
So opioid withdrawals is a very unpleasant state. You feel anxious, everything runs, your nose runs, you can have uncomfortable stomach symptoms, feel cold and shiver, and it's a very unpleasant physical state to be in.
If opioid use continues, you may develop addiction to opioids, which doctors call opioid use disorder.
So opioid use disorder is when you're using opioids in a way that impairs your function, and so and this can happen quick with opioids because they're a very difficult molecule to stop using once you take it, and you can get very quickly into this physical dependence on it, where it becomes very hard to not use, or you go in withdrawal. And sort of the physical pull of opioids then leads to all these functional impairments in your personal life, family life, work life, and then you end up with an opioid use disorder.
There are different factors that can put someone at risk for opioid use disorder. This includes chronic stress, mental illness, family history of substance misuse, heavy tobacco use, and contact with high-risk people or environments. There's also some evidence that genetic factors can make you more vulnerable to a substance use disorder. If you're concerned about taking a prescribed opioid, the best thing to do is talk to your doctor. They can help answer your questions and make a plan for taking the opioid safely.